Welcome to the webinar entitled Tips for Successful Peer-Reviewed Cancer Research Program Applications. This webinar is brought to you in collaboration with St. Baldrick's Childhood Cancer Foundation and the National Brain Tumor Society. We are joined by Dr. Donna Kimbark from the Congressionally Directed Medical Research Program, who is the program manager for the Peer-Reviewed Cancer Research Program, which will be abbreviated as PRCRP. She will share some useful information on how to submit the most compelling applications for the PRCRP. Listen carefully as she defines the program, offers tips for success, and steers you away from any and some of the possible weaknesses in applications. Thank you for being here, Dr. Kimbark.
Thank you, Lisa, and I welcome everyone to this slide presentation on the peer-reviewed cancer research funding opportunities and application review process. Next slide, please. First of all, I'm going to talk to you a little about who is the CDMRP. Many people don't know that about the Congressionally Directed Medical Research Program, so I wanted to talk to you about that and give you a firm setting of where we sit in the government. We're part of the Department of Defense. Specifically, we are part of the Army. We're part of the Army Medical Command. Specifically, we sit up at Fort Detrick at the U.S. Army Medical Research and Materiel Command. Go to the next slide. You'll see a little bit about our vision and mission. The vision of the CDMRP is to transform healthcare for service members and the American public through innovative and impactful research. How we do this is by responsibly managing collaborative research that discovers, develops, and delivers healthcare solutions for service members, veterans, and the American public. We're really looking for that groundbreaking, high-impact research that's going to move the field forward, not only in research, but for patient care as well. Next slide. Hallmarks of the CDMRP program. We are not part of the president's budget. We are actually targeted funds that are added to the DoD appropriation by Congress. Advocates, many consumers, as well as researchers will go to the Hill and ask Congress to add on specific funds for different programs. For instance, the breast cancer program or the peer-reviewed cancer research program. These funds are not added by the president, but by Congress, as I've said. That's an important distinction between the CDMRP and, for instance, the NIH. The NIH is in the president's budget, and therefore, every single year, you can assume that the NIH is going to get some funds. The CDMRP, each one of our programs, we never know. We don't know. So we have a more immediacy and urgency for our funds and how we're going to use them. And that impacts everything and how we do things. The funds really are about high-impact, innovative research for today, that's short-term as well as long-term outcomes. We do try to avoid duplication with other funding agencies. We're part of the funding groups, okay? We're all on the same landscape here. But what we really try to do is make sure that we're not funding the same thing. We want to fund those gaps in the research in order to make sure that we're additive rather than subtractive or duplicative. How do we do this? We follow the National Academy of Medicine recommended model for application review. The NAM, or used to be called the Institutes of Medicine, or IOM, when the Army first received these funds over 20 years ago, they asked the IOM at the time. We said, how do we do this? How do we solicit for funds for breast cancer research? Because it was breast cancer funds. And so the IOM suggested a two-tiered review process that I'm going to go into detail for this presentation and discuss with you how you can turn the information that you learn here into strategies for success. It's important to note that consumers or lay people that have had the disease or they have been caretakers for someone with a disease, condition, or injury are part of the process from the get-go, from the very, very beginning. where advocates, and many times they are consumers, or what we call the lay people are consumers. They're the ones that went to Congress to ask for these funds. So they start off as part of the process early on, and we brought them into the process not only at peer review but also at programmatic review. Those are the two tiers to that application review process that I just mentioned. So consumers and their sense of how this research should impact patients and their families are really part and parcel of who the CDMRP is. Each year, we adapt our program's vision and investment strategy to answer the needs of the research community and the patient care. And this all goes back to that first point on this slide. And that first point of that we're not part of the president's budget. We never know if this money is going to go away or not. So we have to be urgent. We have to answer what needs to be done today because we don't know if there's going to be money or funds for tomorrow. So that's why we adapt every single year to find out how we can change the landscape for patient care in the research community right now today. If we go to the next slide, I wanted to talk to you a little bit about the peer review cancer research program as well. Throughout this discussion, I'm going to bring in information about the peer review cancer research program, so you learn a little bit about the program all along the way. The vision of the peer review cancer research program is really about decreasing the burden of impact, the burden of cancer on service members, their families, and the American public. And how do we do this? We do this by successfully promoting high impact research for cancer prevention, detection, treatment, and survivorship. What you see on this slide, and I think it's fairly important to look at this slide, is that at the very beginning, there was a $16 million appropriation for the peer review cancer research program. And as you can see, we've had a really steep incline over the last 6 or so years. It's really nice in those last 6 or so years that we've been able to broaden the scope and broaden the number of topic areas that are added to the peer review cancer research program. Those topic areas are ones that Congress directs to us. I do not sit at my desk and decide which topic area is going to be added. It actually is directed to us from Congress, and they're added to the peer review cancer research program because they've heard the voices of their constituents, specifically the advocates and other people going to the Hill and asking for those topic areas to be added to PRCRP. You can see that the appropriation has increased over the years. We have $80 million for fiscal year 18. Going to the next slide. These are our topic areas for FY18, fiscal year 18 for PRCRP. You can see there's a number of different topic areas on that left-hand side of the slide. There's 17 of them. Some of them are brand new this year. Adrenal cancer is brand new. Blood cancer was in the PRCRP for some time, and then it dropped out, and now it's back again. We also have myeloma, which is also a type of blood cancer in the PRCRP that's new this year. Some topic areas that are specifically important for this audience would be brain cancer and cancer in children, adolescents, and young adults, as well as neuroblastoma and pediatric brain tumors. We also have immunotherapy, which might be an interesting topic area for this audience to consider. All of these topic areas are considered as important as the next, but as you can see, as I will talk to you throughout this presentation, I'm going to talk to you really geared towards our quote unquote brain cancer topic area today. The applicants must address at least one of these topic areas as directed by Congress. They can't decide, oh, I really want to look at this other cancer. No, these cancers are the ones that we're going to review. Funds may not be used for research into breast, prostate, ovarian, kidney, or lung cancers. And the reason for that is because of the fact that these 5 cancers have their own research programs within the CDMRP. So these funds should not be designated for those. And if you do apply with one of those, you are considered non-compliant. Research progress should be relevant to service members, their families, veterans, and other military beneficiaries. And that becomes a question. A lot of people ask me and say, well, how is this going to be militarily relevant? Uh, Cancer hits everyone, both lay and military alike. I'm going to talk to you about strategies to answer that as well. We go to the next slide. Here's our congressional language for PRCRP, and I wanted to point out some of the topic areas that are relevant for our conversation today, and that's brain cancer, neuroblastoma, and pediatric brain tumors. As you can see, pediatric brain tumors was one of our first topic areas in that very first year for FY09. It started out and it remained with us for 2 years, and then it dropped off. We had it come back again, and then it dropped off again. And now it's back. And so right now for FY18, we have brain cancer, we have neuroblastoma, and we have pediatric brain tumors. We have those three topic areas I think are really good topic areas for us to review. And we have $80 million. But remember, we do have 14 other topic areas under the PRCRP. Going to the next slide. I'm going to review a little bit about how the money has been spent for the brain cancer funding history. You already saw the history of the PRCRP overall, how much money was put in to the PRCRP through FY18. FY18, we are just in the midst of right now, so we don't have any data on what has been invested under brain cancer. Now, brain cancer funding, I'm including brain cancer, neuroblastoma, and pediatric brain tumors. As I said, for the first couple of years, we had pediatric brain tumors, and we had a lot less money. So you can see how much money was actually invested in pediatric brain tumors for the first couple of years. The numbers that are below in the parentheses, that's the number of awards. And so you can see throughout the years we've been able to invest a good amount of money in our brain cancer topic area. But last year, for FY17, we had almost $10 million with 15 awards that are being negotiated right now under the brain cancer topic area. The total congressional appropriation for PRCRP through FY18, this is including what has not been decided on yet, almost $340 million. Brain cancers applications that have been received through FY17, about 660. Total brain cancers awards made through FY16, not 17, because those are under negotiations right now. We have about 39. And the total awards pending right now are 15. So as long as the topic area is present, we've been able to fund in the topic area. So that's an important part to remember. It's great to have the topic area included. One of the things that our programmatic panel does is to ensure that each and every of our topic areas does get funded. There's only been one topic area in the 10 years that PRCRP has been around that was not funded, and that's radiation protection utilizing nanotechnology. Unfortunately, we did not receive any meritorious proposals for that topic area, but every single topic area has been funded otherwise. Going to the next slide, I'm going to talk a little bit about what we have funded in those areas, for brain cancer, and how do we actually cut and slice those pies. Okay, so I'm going to talk to you a little bit about addressing our program priorities along the cancer research spectrum, all the way from scientific modeling to biology, etiology, prevention care, detection, diagnosis, prognosis, treatment, and finally survivor outcomes. We take our whole portfolio and we code it for these categories and put them in buckets into these categories to see what exactly we're actually funding in what areas. And then we can actually use that in our vision setting, in our investment strategy meetings, to actually make some ideas about what our investment strategy should be for the coming years. We look at the next slide. The next slide actually gets us from FY09 through FY17, our PRC portfolio analysis for brain cancer portfolio. You can see that we've put a lot of money, almost 29, 30% of our money goes into cell biology. A nice 20% goes into immunology, and another 23% goes into the therapeutic area. We have some smaller areas as well. You can see this is how we slice and dice our pie, okay, for brain cancer. Some examples of our outcomes so far. Dr. Lee developed a critically needed mouse model for diffuse intrinsic pontine glioma that is currently being used in preclinical therapeutic studies. And Dr. Friedman he's conducting preclinical studies to improve the safety and efficacy of oncolytic viruses. So these are just two snapshots of what we funded in the past to get you an idea of some of the information that we are looking for and what we are funding. Next slide. You can see how do you apply, okay? Because that's really what you want to know, okay? All of this other stuff is nice, some nice pictures and all of that, but really what you want to know is how do you apply and how do you get funded. So now I'm going to go into a little bit about the program cycle, and from that program cycle, then I will explain to you how we review applications, and then finally I'll get into those tips for success. So this is our program cycle. I talked to you a little bit about that congressional appropriation, the DoD appropriation, where monies for the PRCRP are added to the DoD appropriation because of stakeholders like advocates going to the Hill. That's the first step along the way. Okay, so a stakeholders meeting is only held in the first year of the program. So we did not have one this year. We did have a vision setting. Our vision setting is what our investment strategy meeting is, okay? Our programmatic panel gets together, and we do have a programmatic panel of, we have clinicians, we have research scientists, we have consumers, and we have military active duty oncologists on our panel. Everyone comes together and we talk about the research landscape and what the funding of that research landscape is all about and what patient care needs for each one of these topic areas. After we do that, then what comes out of that is what we should be funding. What funding opportunities or program announcements should we put out to solicit applications? So after that's done, then we release those funding opportunities on grants.gov, and people can then apply. The pre-application, there's a two-step process to applying. First, pre-application receipt, and then application receipt. Pre-application may be that you have to write a short 1-page, 3-page pre-proposal, a narrative about what you're going to propose and what you're going to do. Or you can just have a letter of intent, depending on the type of funding opportunity it is. That letter of intent will simply say, "I'm going to apply." But if the funding opportunity requires a pre-proposal, you have to put a pre-proposal together. That pre-proposal then will be screened for the adherence to what we're looking for and how close it is marrying what we're looking for by the programmatic panel again. That programmatic panel will get back together and look this over and make recommendations on who should be invited. And then finally, we come to the second step of the application submission process. That second step is putting together your full application and submitting it to grants.gov. Once that's been submitted, then we get into our application review process, which includes our peer and programmatic review. Remember that two-tiered review I said that the IOM first recommended to us way back over 20 years ago? That's the peer review and the programmatic review. I'm going to talk to you in depth about those in the next couple of slides. After programmatic review, we have our funding recommendations. Those funding recommendations will be approved by the commanding general of MRMC. And then finally, we go through award negotiations and award monitoring. Going to the next slide. Let's talk a little bit about that two-tiered review process. There's two tiers. There's peer review and programmatic review. They work separately as separate entities. The people that are on programmatic review are not on peer review, and the peer review people are not on programmatic review. There are two different panels. The peer review panels are built up each and every year. The programmatic panels are established panels. So they work together. They work separately, but there is a partnership between these two, and that's an important distinction. Let's go to the next slide so we can talk about the first tier of peer review. That first tier of peer review is how the evaluation process actually works. What is peer review? Peer review is where we are looking at the technical merit and impact of the application. And how do we look at that? Do we compare it to the application that the other applications that I'm reviewing? No. We compare it to the gold standard, okay? If you had the absolute most perfect application, what are we looking at here? How does it compare to perfection? Now, we can all say that we got 100 on something, but we don't always get 100 on everything. So there's always some strengths for every application, and there's always some weaknesses. So that's what the peer reviewers are going to look at. They're going to look at the strengths and weaknesses of all of the criteria. The criteria could be scientific merit, it could be innovation, it could be impact, it could be personnel. So there can be a number of different criteria depending on the funding opportunity that the peer reviewers will be looking at. The peer reviewers are a panel that are composed of scientific and consumer reviewers. There's no standing panels, as I've said, and the reviewers are recruited based on their expertise. It's important to note that there is no interaction between the applicants and the peer reviewers. That's not permitted. The outcome of the first tier of review is the summary statement. The summary statement includes numeric scores as well as written verbiage about each and every one of the criteria, and that criteria that will include strengths and weaknesses. We go now after we're done with all of that, we're all done at peer review. Those summary statements now are moved to the next the next step of review, and that is the second tier of the programmatic review. I'm on the next slide. This is where we have our programmatic review panel. There will be expertise on each and every one of the different topic areas. It's important that you note that we do try to include as many as many experts as possible. If we don't have the expertise on our standing programmatic panel, then what we do is we get ad hocs and bring them in. Our programmatic panel members stay for a number of years. They rotate off according to their time and according to our request, or also according to expertise of the panel. So we do keep that in mind all the way through as we continue forward. So the programmatic panel is a comparison-based process. This is where we're not comparing it to an ideal application, but what we're actually doing is we're actually looking at it as against one another. We're looking at two different brain cancer proposals. Which one is actually closer to the intent of the award mechanism? Which one is going to leapfrog the field forward? How does it work in what's been funded before, in not only in our funding portfolio, but in others' funding portfolio. So we do look at a number of different things. So we're looking at the adherence to the award mechanism, the potential impact, the program relevance, and so on. So all of these are really important to consider as we move through the programmatic review. So the programmatic review, the outcome of that, the deliverable for that is the funding recommendation. As I said, the programmatic reviewers do comprise of consumers, clinicians, researchers, and we also have military members on our panel. It's important to note that we do have ad hoc reviewers um, to increase our expertise. Going to the next slide. Okay, how do we get to the funding opportunities? Because that's one of the most important things. How do I get there? Okay, the first thing you do is the funding opportunities are, you can actually link to them on the CDMRP website. There's a couple of places that you can click on right up there at the toolbar is the funding opportunities. And also for investigators is a big, huge area to click on for investigators. I'm going to just stand here and wait as you scribble that down. That web address down. You can also put CDMRP into any of your web search engines, and it'll pop up as well. So that's important. This is where you can first go to look for what might be available. But maybe you're not there, and maybe you just like to go to grants.gov. Grants.gov, if you're really interested to find the CDMRP funding opportunities, all of the different funding opportunities, you can search for it with the CFDA number 12.420, and it will all come up. You can see a screenshot there that shows some of the funding opportunities that were available at the time that this slide was made. The peer review cancer research program will come up as well. Now I'm going to tell you a little bit about what funding opportunities are actually offered this year for FY18 for the peer review cancer research program. And that is on this slide. I went to the next slide. We have the IDEA Award with Special Focus, the Impact Award, the Translational Team Science Award, and the Career Development Award. I'm going to talk about the first three because the first three are a little bit different than that last one. The first three require you to write a project narrative pre-proposal. Okay, you actually have to write the pre-proposal. So the IDEA Award with Special Focus, the eligibility is all researchers at the faculty level are eligible. What is an IDEA Award? It's really the foundation award for our program. It's really about supporting highly innovative, high impact, high gain research, or really looking for that push forward in the field. One of the things that I like to talk about innovation is that number one, you can't define it. Number two, it's like beauty, it's in the eye of the beholder. And number three, innovation in the 17th century was considered, if you were an innovator in the 17th century, you were considered a heretic. So everybody here should be heretics. We really need to have those people that are going to think out of the box and different. And so that is one of the things that I really want to emphasize is that innovation. The IDEA Award with Special Focus requires that you address military relevance. And I'm going to talk on that in a moment, so I'm going to leave that there. Preliminary data is discouraged. If you don't have preliminary data, that's okay, but you have to have a sound argument and some literature references in order to say why you're doing this. The direct costs are $400K over the entire period of performance of 2 years. That's not $400K each year, that's $400K for 2 years. The Impact Award is another one that requires the pre-proposal narrative. And you can look in the funding opportunity itself to see the requirements for that. To be eligible for this, you have to be an assistant professor or above. And what we're really looking here is for those more mature projects, those projects that already have preliminary data, because preliminary data is required. What we're looking to do is to focus specifically on critical scientific and clinical cancer issues that can have a huge potential impact on one of our topic areas. We want to really push that field forward. This is where translating from basic on towards you're looking for the next step in clinical research. So we're really looking for more applied translational type of research for this. This is $1 million over 3 years, and if there's no partners there, I'm sorry for that. And so there's $1 million over 3 years of the award. The Translational Team Science Award is the third award mechanism that's important for us to consider as a pre-proposal narrative is assigned for this one as well. An assistant professor you have to be eligible as an assistant professor or above. This one does have those partners. So you have 2 to 3 partners all working together on one overarching project with the correlative studies that are associated with an ongoing clinical trial. We do allow for clinical trial funding support, and as with all of our award mechanisms, there is an emphasis on military relevance. Preliminary data is required here, and it's $1 million amongst the partners for 4 years. Finally, we have the Career Development Award. The Career Development Award is very different than the other 3. Not only is it more based on the person, but it is also the only award mechanism where you do not have to write a formal pre-proposal. You have to write a letter of intent which says, I'm going to apply, but you don't have to actually write anything scientific about it at this point. And you're not going to be invited. You just apply, you just send in your letter of intent, and then by the due date, and then you send in your full application. You're not looking for an invitation. The Career Development Award is an independent investigator within 10 years of their terminal degree. So that's really important to remember that it's 10 years from your terminal degree, either an MD, PhD, or so on. If you have a medical residency in there, you don't have to count it within that 10 years. Or if you left for family medical leave for some reason or another, you don't have to count it either. Your biosketch should reflect that, though. You do have to have a career guide. This is kind of a mentor to at the level of associate professor that can kind of move you through the wickets of your career. This supports impactful research. Once again, we have the military relevance. Preliminary data is not required here, and the direct costs are $360K over 3 years. Go to the next slide. Now I'm going to talk about those military relevant focus areas. This has always been a good challenge for some people to really wrap their heads around. How am I supposed to do this if I'm answering something for neuroblastoma, or if I'm answering something from pediatric brain tumors? There's 2 military relevant focus areas that are required. One or the other are required for each and every application to address. The first one boils down to environmental exposures that the military might encounter during deployment, from ionizing radiation to infectious agents and other environmental carcinogens that could lead to cancer at some point in their lives. Okay, so that's an easy one. I think that everyone gets that one very easily, especially if you're happen to be answering like the mesothelioma topic area, or blood cancers, or melanoma. All of those are very easily understood how they can connect up to the military. But how do you connect up to the military something like pediatric brain tumors? Very hard to do that, right? No, because you have to think about the service member, who that service member is. If a service member's child is diagnosed with cancer, a pediatric brain tumor, is that person going to be mission ready? Are they going to be, do we have force readiness now? Because remember, each service member within a unit is important, is integral, is critical for that unit. If that service member has to ask for an exceptional status, cannot be deployed because their child is sick, or their child is sick while they're deployed, are they 100% in the game? No. So that's really an important part to think about. If your spouse comes down with a brain cancer, if you have brain cancer as a service member, that is a direct hit on that support system for that service member if their family members get sick. If they get sick, yes, it's going to be a problem for mission readiness, for force readiness. So this is what we have our two militarily relevant focus areas. Environmental exposures is one, mission readiness is our second. So we go to the next slide, which is we're going to get into the components for a successful application. Next slide, please. Applying for a grant. Okay, I've told you where to go. Okay, I've told you where to go to apply for a grant. Going over to either the CDMRP website or to grants.gov, and you can find where it is. Now, the first step to figuring out how to apply for a grant and your grantsmanship goes to the program announcement that contains all of the information. Now, I want you to go through that program announcement. I want you to do it the old-fashioned way. I want you to print it out. And when you print it out, I want you to do it the even older-fashioned way. And I want you to get your highlighter. And I want you to highlight things like the award information, the project narrative, the other attachments. And then I want you to read the section about peer review and programmatic review. Okay, you might not think, well, I'm not going to be a peer reviewer. I'm applying. You have to read all the way through the program announcement. If you read all the way through the program announcement, you'll figure out the program goals, the award intent, the required elements, whether or not you're eligible. I just talked to someone today who was not eligible. You have to look at the eligibility, the funding, the review criteria, as well as deadlines. Keep in mind those deadlines. And do not start your application 2 days before. You're not going to have enough time. Read the announcement carefully. I know some of it's boring. I wrote it. But read it all the way through. Go ahead and do that old-fashioned way. Let's go to the next slide and talk about some strategies for success. As I told you, you really have to talk about relevance. How is your application the one that should be funded? You know, we talk, if you ever go to a class about fiction writing, for instance, you go to a class about fiction writing, the first thing they tell you is show, don't tell. Okay? Don't tell me someone is happy. Show me how someone is happy. And that's exactly what I'm going to tell you here. Show, don't tell. Demonstrate how yours is the most innovative. Show me how it's impactful. It's going to change the course of patient care. Even if it's a basic research, it could, in the long run, change the course of patient care. We need to know that information so that you can rise to the top. It's important to do that. And it's also important to look at not only relevance, but impact and innovation, as I've talked to you a little bit about, and the feasibility. I want to talk a little bit about feasibility and expertise. Make sure that you have the right expertise on your application. Okay, if you're if you're in the area of a young investigator and you're going to apply to the Career Development Award and you've never done anything in brain cancer, might be a good idea to walk down the hall and find that career guide that's a brain cancer person. Bring that expertise in and bring those biostatisticians in early on in your application writing. Don't bring them in 3 days beforehand so they can look at it and see whether or not it's appropriately powered. That's not when you should do it. You should bring those statisticians in early on and show us that you have the resources and reagents and study populations that are important to move your study forward, and that you're not going to be bogged down in the muck of trying to get all of this moved forward after you've been funded, because that's surely a way not to get funded. Next slide. Some more strategies for success. Timelines, okay? This is really important. Coordinate everything. Make sure you know the timelines. The timelines are on the front page of the program announcement, the very front page. Make sure that you know them. We do not allow for late applications. We don't. We just say no. And I know it sounds terrible. It's a minute after and you didn't get it in on time, and there's nothing I can do. My grants officer is going to say no a million times, and there's nothing I can do. So make sure that you coordinate everything. Make sure that you understand how grants.gov uses their workspace these days. Make sure that everybody has the right Adobe PDF so that everyone is on the same page. And finally, when you're going to look at your grantsmanship, this is one of the things that we always talk about, grantsmanship. We talk about that all lots and lots. And are you writing clearly, or are you making it as complicated as possible? Because remember, the peer reviewers are reading pages and pages and pages. And if you're tiring them out, you're probably not getting your point across. So make sure that you decrease the jargon, make clear what you're trying to communicate, and review all of your application before you go ahead and submit it. And make sure that somebody else reads it too. And also always be compliant. Don't break the rules. Don't break the rules. We have rules on how big your font should be and all of that stuff. You have to be compliant. If the funding opportunity says no clinical trials allowed, you cannot apply with a clinical trial. It's just not allowed. Okay, so that's important to make sure that you are following the rules. Some pitfalls to avoid. Okay, this is the big one. Okay, do not include any of the program panel members for your program and fiscal year to which you are applying. Okay, the PRCRP, if you go to the CDMRP website and you click on that toolbar for research programs and you find peer review cancer, click on that. And on our page, there will be an icon for programmatic review panel members. Click on that and you'll see who our programmatic panel members are. You are not allowed to have them on your application. They can't be a career guide. They cannot be a collaborator. They can't be a consultant. Nothing. Don't mention them in your application. If you've worked with them in the past and you happen to have a current grant, that's okay. If you've published with them in the past, that's okay. You just can't have them a part of the application. Remember to not overgo the page limits. Make sure that you have the correct version of Adobe, and don't miss the submission deadlines. As I've already said, we can't allow that. You understand how to use grants.gov workspace, and in fact, grants.gov has a couple of different learning tutorials on their website for that. Consider using those. And submit the correct project narrative and budget on time, because these components cannot be modified during the verification period that we have on our portal called eBRAP. Next slide. And once again, at the very top is our URL. I'm going to let you go ahead and write that URL down if you forgot to do that previously. And underneath where the logo for CDMRP is, you'll see that research programs. That's where you should click on in order to get to the peer review cancer page, which will give you a wealth of information, not only on our programmatic panel, but also on our previous year's reports to Congress, on exposures that are linked to cancers and it might be important for the military, as well as our program book that talks exhaustively about military relevant focus areas, as well as what we have funded in the past. And now I'm going to thank you for your attention during this briefing, and I'm going to turn it back to Lisa.
Thank you so much for all this very useful information, Dr. Kimbark. We appreciate your guidance to ensure researchers can have great success in their grant applications for fiscal year 18. For further information on the PRCRP, please contact Lisa Peabody with the National Brain Tumor Society or Liz Jackson with the St. Baldrick's Childhood Cancer Foundation. Our contact information is on the slide. Thank you so much.